because she's standing there with nothing to do. Dr. Veronica, you can put your light handles up. You can start putting your suction up and Bovie. Now, this just came off. This would be attached here. To attach your Bovie, because this is a crappy one, it should go there. You put your Alice through here. This, I use an Alice just because I have extra ones. It has to be a non-perforating whatever. And the reason is, it can't put a hole through here because you contaminated the drape. So this is not, it's Atramat, so it won't poke a hole. So it usually, this is broke, but it will act like it's working. I'll pull it up, stick my things through it. Remember, make sure you tug like this because you can get a hold of your patient, trust me. This is like a spider. You would undo it. It goes under your Mayo, not on top. Circulator then would hook that up. I usually wrap this around. That's what these two little notches are for, so it doesn't fall in the floor. Put that here. Suction tubing. I don't want to undo this one. This one's easy. You can use this same clip, or you get another clip. Shoot the back up this time. Undo it. Goes under your Mayo. I usually hook it here like this. Put this here. Yankar goes in the end. And that way they have suction here. A lot of times the assistant is the one that gets the suction, not the primary. Just because he's busy operating, they're busy cleaning up, all right? Bovie's up, suction's up, light handle covers up. I'm gonna lay out 2 sponges, and then what do we do next?
Timeout.
Timeout, perfect, yep. So now we go through this whole shebang right here. Whew, go through name, patient's name, allergies, estimated blood loss, estimated time of procedure. We go through the room as in who all is here. All right, D, Veronica, blah, 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 blah. Go through, blah, 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 blah. Everybody agree? We agree. Then, Veronica's gonna ask me then for a knife, all right? But before that happens, I'll say, oh, wait a minute, let me get my stuff. I'm gonna wheel this here, ready to go. This is a knife. I'll automatically get it ready. She's gonna go knife like this. I'm gonna put it here. She's here. Make sure you keep your eye on that because she can easily lay it here or lay it here. As soon as they lay it down, get rid of it, all right? As in pick it back up and either put it here or put it there. I a lot of times put mine here, but I put it closer to me just because I know where it's at. If they're done with the skin incision, I usually take it back because once it's done with the skin incision, it's considered dirty because skin's dirty, all right? You'll have another one loaded up, ready to go. For your competency, we'll go through things as in ask you, I'm sure I will be your surgeon. If you're struggling, I'm gonna go through every single thing that's on this Mayo for you to hand it to me and hand it to me right, the right way, all right? As far as pickups, knives. Now, when you hand instruments to whatever hand you grab it, let that be the hand that you pass. Don't do this, and then that. That's more ways to contaminate yourself. So if it's here, I can either pick it up here, put it in here, or I'm right-handed, so I'd probably pick it up here, put it here, okay? A lot of times when they ask for pickups, they want scissors to go with it, all right? We'll go through the whole shebang. I'll probably ask for something for back here. You'll have 2 sutures ready to go. I'll ask you for a left and a right, just because I need to know that you know how to do it and to pass it to me correctly across the way. We'll go through that and then I'll go, okay, we're closing, let's count. I'll ask you what to count. So instead of going through all this again, because it'll take forever and we got so many of you, we'll count the order that it is: field first, Mayo next, then back table. That's the way you always close coming out, okay? Then you do SSI, which is to me, sponges, sharps, instruments. If you do sharps then sponge, it's not a big deal. Again, your circulator can probably lead you, but I always do sponges, sharps, instruments. Here, here, here. So we would start with sponges, and I'd go 18 by 18s, 1, 2, da 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 da. Circulator would go, okay, here's 3, 4, whatever in the bucket that I tossed off in the red bucket. Then I do sharps. I'd go, all right, she's sewing with 1, here's 2, inject, so on and so forth, go. First, second, third. Then at that point, once we go through it, I feel comfortable, I'll tell you to step back, take your gown and glove off the correct way, wash your hands, and then we're gonna switch. And that's it.
Where would your basin go?
I usually leave mine back here just because I don't use it that much. But if you really wanted to, you could move it up here. But at that point, I don't really use my basin much, not till the very end. Just because if I need water, I'll get it back here and then put my wet sump right here. Because a lot of times when they hand it back, they're gonna expect you to wipe the instruments off. And if they do, you have to wipe it with water, not saline, because saline will rust them. Remember, locked, unlocked, locked, unlocked. This would have had my tie on the pass on it. Remember, it goes off the very end, not the side, straight off. And all you do is pick it up here, whoop, here, let it go. Automatically, they're gonna need suture scissors right after this because they gotta cut it, okay?
Why do
So-
you leave those unlocked?
Just because these are moved, and then at the very end, when you go to restring them to send them back to SPD, you don't have to open them all up. And these, if they're dirty, you leave them open and you can throw them in your basin, or you would put all the clean, put a towel, and then put them on top of there open, because they have to wash them open. They have to go through the decontam open. Any questions? This is it, pretty much, boom, 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 boom. If I put my scissors here, so be it. I like my scissors closer to me, okay? That's me. And I like these here. But again, remember, I told you I always put mine hanging off the edge. That's just me. That's how I was taught. I'm a creature of habit. Could I do a towel? Yeah. Do I like a towel? No, but that's me, all right? When you get to clinical though, especially with you being fresh, until they get used to you and comfortable with you, you're gonna have to do it their way. Whether you get used to a towel or not in here. If they don't use a towel, they're not gonna let you use a towel. I can go ahead and tell you that. And you'll still get those occasional ones that can't give up control some, and you just have to do it their way. But you'll learn that. You'll learn that. And